Hello, my name is Tado Masaki, and I am a veterinarian specializing in the treatment of tumors in dogs and cats in Osaka, Japan. For 20 years, I have been working at a secondary care facility, conducting CT scans, surgeries, and chemotherapy for referred tumor cases. Recently, I have started my own business called Vetscom, where I visit various hospitals to provide treatment and surgeries for animals with tumors. I mainly visit hospitals in Osaka that I have contracts with, teaching the next generation of veterinarians the procedures and surgical methods for tumor cases. Additionally, I accept surgery requests from hospitals outside of my contracts through my website. I conduct pre-surgery consultations based on CT scan data and ultrasound examination data, and then visit the hospitals to perform the surgeries. The purpose of starting this business is to share my knowledge and skills with local hospitals to improve the survival rate of animals with tumors. While I worked at a referral facility for a long time, the practice of referring cases became established, leading to a situation where surgeries were not performed at local hospitals and diseases progressed while waiting for secondary care. While center hospitals with expensive equipment are necessary, I believe that by raising the level of care in the community and building a network of animal hospitals capable of handling tumors, we can increase the number of animals that can be helped. This time, I have launched Vetscom channel to share the techniques necessary for veterinary oncology surgery with veterinarians who are fighting tumors together. I will share various techniques that I have cultivated over many years of surgery, from how to use hands, how to handle instruments, to methods of ligation. Rather than thinking that my skills are superior, I hope that those who find it useful as one methodology will adopt it, which may change the precision and speed of surgeries. Veterinary oncology surgery is different from human medicine in that a single veterinarian must perform surgeries on various parts of the body. In human medicine, specialization is advanced, and a doctor who cuts lungs does not perform anal surgery, but veterinarians often face the need to handle tumors in various parts of the body. While I believe that specialization and increased expertise are desirable, veterinarians are required to improve their ability to handle any surgery. Although surgical methods can be seen in various media, it is not easy to actually perform them. This is because the steps to acquire the skills are not systematized. It is extremely difficult to improve surgical proficiency while also studying internal medicine in daily practice. Veterinarians who explain in books and videos may not be good at teaching beginners because they have been performing surgeries for a long time. I was also not good at teaching others, but after being pointed out that my explanations were sensory and difficult to understand, I worked on breaking down and verbalizing my skills. While analyzing the meaning of unconscious hand movements and thinking about them in detail, I made many discoveries. As I continued this work, I felt that my surgical skills were improving. I realized that the day had not yet ended even after the surgery was over. I thought that my surgical skills would not improve any further, but even as I got older, understanding the logic led to another level of improvement. I have also read books explaining human surgical techniques, but there are many things that cannot be applied to animals. For example, there are many differences such as the thickness of the skin, the difficulty of keeping animals still, and unique diseases that vary by species and breed. I feel that animals need their own surgical know-how, and I hope that my skills will be of reference to someone. I hope that the parts that can be adopted will be adopted, and if there are better methods, I would like to learn them. Let's improve our skills together in this way.